morning, friends. Dr. Phil from Wayne County Hospital here. Today we're going to talk a little bit about Clinimix parenteral nutrition. So it's important to know whether you're watching from Kalamazoo, Michigan or Kathmandu or wherever, this is Wayne County Hospital policy. This is how we do it. And this is a little bit of nursing education just because we don't have pharmacy on site 24/7. This is just a reminder a little bit about Clinimix, how to mix it, and some important things to look out for. So let's get into it. So when you get your Clinimix kit, or if you have to come to pharmacy and get it, you're going to have your Clinimix. Sometimes they're in these foil pouches, sometimes they're in a clear overwrap. It's important to leave them in the overwrap, be it the foil or the clear, until you are ready to mix it. So there's a couple different strengths. There's 5/20 or 5/15, and that depends. So the 5 means that it's 5% amino acids, so 5% protein, and either 20% or 20% or 15% dextrose. So protein and sugar, it just depends on your patient and their caloric needs, what's been ordered. So it's important to pay attention and make sure you're getting the right strength and also the right size bag. So we have these in both 1,000 ml and 2,000 ml bags. Usually when we're starting TPN, we're starting at 40 or 50% of the normal rate that we want to run it at. So let's say we've got a patient that they're going to be getting their TPN at 80 milliliters an hour. We'll start off at 40, so 40 mils an hour on a 24-hour bag, because you got to change these out every 24 hours, bag and line, regardless. So we use those smaller bags so we're not throwing over half of the 2,000 ml bag away. So to open this up, turn this right along here, and it is perfectly normal for there to be some moisture inside the bag, inside that overwrap. That's why it has to stay in that. Otherwise, the moisture can escape, and that causes issues. So we've got two different sides here. One side has the protein, one side has the sugar, and we have to mix these. So see this little stripe here where the two sides are kind of welded together? We lay that on the counter, and we're going to roll this up, and it's going to make a satisfying pop. So here you can see the top half of it has split, the bottom half is not. We'll turn it over, and you watch here as I roll it up, it's going to burst that seal between the two chambers. So now we want to take this and invert it a couple times. That's going to help get everything mixed up nice like it's supposed to. Also, you'll notice usually on your label we're going to include a multivitamin in this. So we generally use the Infuvite adult multivitamins. So there's 2 different vials in here. So 1 dose is both vials. So each vial is 5 milliliters. So you're going to have a white top and a blue top, and they both need to be put in the bag. Just like anytime we're mixing something, anytime we're puncturing a stopper or a bag with a needle, we want to make sure we wipe those stoppers off with an alcohol wipe before we mix this. Give that an opportunity to dry here. Okay, so that stopper is nice and dry. So this one here is very yellow. Again, that's the vitamins, and it's going to turn this bag a nice bright yellow shade. That's how you're going to know that you have mixed this properly, because the whole bag, both sides, are going to be bright yellow. Alright, that's pretty satisfying right there. I always think it makes it look like Mountain Dew. All right, now that we have that in there, we will again take and invert the bag a couple times. That's going to make sure that that gets mixed all the way through. And again, see how we have color both sides. That's how we know that that seal is broken. Furthermore, all of your Clinimix needs to go through a 0.2 micron filter. We have two different kinds of filtered sets. We basically use whatever we can get because there's shortages. So sometimes it's going to be a filtered infusion set, and that's your full Alaris IV pump set that has the little filter. And it says right here, 0.2 micron filter. We also have 1.2 micron filters, but we use those on the Nutrilipid, which is the fat emulsion. Also, there's these filtered extension sets. And these are nice because you can just use a regular run-of-the-mill primary tubing, or even, you know, if you have it as a secondary, you can just put this on right between where that IV line goes into the patient's cannula. Oh, and it's right here, and it's pretty small, but it says right there it's the 0.2 micron. So to recap, we're going to want to make sure we leave this in the overwrap until it's time to mix it. We pull it out, we roll it to break that seal, and then we put both a blue top and a white top vial of the multivitamins in, mix it up, and we're making sure that we've got that going through a 0.2 micron filter. So thanks for watching. Hope this helps. Have a good one. One last thing I forgot to mention. Make sure you slap your patient label on there and make sure you scan it. Thanks a bunch. Bye.